MAPV Access Program presents Accessible Pharmacy. Q&A session.
So the trial offer, and this actually segues into a question that was just posted. Joanne just asked the question, how easy to open are the various packages? So one of the things we'd like to share with everyone is, we don't know. It really is based upon the person. But what we'd be willing to do if you're interested, if you pick up the phone and call our pharmacy, you'll speak to someone in the pharmacy. You can try out a vitamin of your choice. We have about 8 vitamins that we're offering through this program. They'll let you know the vitamins. You can get a month's supply of a vitamin. You can get it in the packaging of your choice with the labeling of your choice. And you can try it out. And it'll give you an opportunity to see what it's like to engage with our care coordinators and our pharmacists. You'll see what it's like to get some of this packaging. You'll be able to see how easy it is to open. And I would recommend when you're speaking to someone, let them know if you have specific dexterity issues, that they may be able to make some suggestions about what may be easier for you and your specific needs. And try it out. There's no strings attached. If you like it, we'd love for you to join us and try us out with your medication. It's really easy. The entire conversation takes less than 10 minutes. And in that 10 minutes, we capture information about your doctors, your insurance company. We make some suggestions. We try to get an understanding about your medication. And then we can get started. As we mentioned, we accept all forms of insurance. So it's a pretty easy process. So Joanne, the woman who asked the person about the packaging, like I said, I'm not sure about your specific needs, but please feel free to call and just try us out. We'd love for you to actually see what it's like to open a package and see how easy it is or difficult it is. Then you can feed back to the team and say, this exceeded my expectations. It was too easy, versus I just couldn't figure this out. I could really use some help. And interestingly, we actually are planning on doing a program with an organization that represents people with severe mobility issues, whether it be paraplegics or quadriplegics, to try to figure out how can we make that experience even easier. We're not there yet, though, but it's a work in progress. We do learn from our patients. We do learn from our employees. We learn from groups and organizations who we work with. So we also invite everyone to give us feedback. Obviously, we love good feedback, but bad feedback sometimes uncomfortable to hear, but it helps us grow. So this is a learning process for all of us. So we'd love to open the floor to more questions. I'm trying to think if we missed anything. Oh, as we mentioned, we are able to package all of our packaging in both Spanish and English labels. If you do need support in Spanish, you can request that. And Be My Eyes, we have a team overseeing Be My Eyes between the hours of 10 o'clock and 4 o'clock, Monday through Friday. And that being said, if you need to interact with someone with Be My Eyes out of those hours, just call on the telephone and we can schedule an appointment, or we can turn the machine back on so that we can jump in and help you with Be My Eyes. You don't need to be a patient of ours to use us for Be My Eyes. Obviously, if we are familiar with your medical history, we can give you much more in-depth feedback. But if you simply want to take a remedy and you want to know if it interacts with your medication, or need help with a label, or need help with anything, please feel free to interact with us through Be My Eyes. We are, as Alex mentioned earlier, we do run an educational series with Be My Eyes. So we're going to be publishing a new calendar at the beginning of April. But some of the topics we're going to be discussing later on this year are different types of cancer topics, breast cancer, colorectal cancer, lung cancer. We are working with the American Cancer Society to provide all of their pamphlets in Braille as well, that are available free of charge for anyone who's a Braille reader who's interested. We're going to be doing programs with guide dogs and companion pets. So as a blind, how do you manage your pet's medication if you're still struggling to try to figure out your medication? And we're doing that with the guide dogs for the blind in California. They're actually we work real closely with them with Be My Eyes, to the extent that we do home COVID testing for all their volunteers and trainers. So we actually send them kits to their home. They engage us through the Be My Eyes app, and we walk the person through actually doing the test in their home. And it's actually working so well. We're looking to expand that model to provide a whole collection of at-home testing as well. So, so there's a few other questions here. Asia just asked, do pharmacies print their own? We actually do. We are a pharmacy. So what we do everything from A to Z. We support you with questions. We interact with your physicians. We interact with your insurance companies. We pick, pack, and ship prescription medication, over-the-counter medication, vitamins and supplements, and small accessible medical devices such as talking glucose meters, talking thermometers, talking blood pressure support mechanisms. And throughout the course of the year, we're going to add some other products as well. All right, what did you say?
What is your phone number again? I'm going to put it in the chat.
Oh, cool,
Happy
okay.
to give it to you, Jerry. The phone number is 215-799-9900. 215-799-9900. Operators are always standing by Monday through Friday. And again, I want to reiterate what Andy clearly said. You don't have to be a member of Accessible Pharmacy. We'll support you.
Amy just asked a question. Are you able to package liquid medications such as eye drops? Yes. And in the event that it needs to be refrigerated, we're able to do that as well. Not in all cases, but in some cases, we are able to interact and advocate for you with your insurance company to allow us to add additional quantity of drops to the bottle, so that, you know, it's a hard target to hit sometimes. So, you know, try to get the insurance company to allow us to do that, to give you some more drops as well.
Ken, you have your hand raised. Do you have a question?
Yes, thank you. I'm a Medicare Part D person. Most of my prescriptions I order for 90 days, 3 months.
Mm-hmm.
Do you do 90-day
Oh,
prescriptions?
absolutely. So
Yes.
I learned this myself. So the way it works is it's all dictated by the insurance company. If your insurance company allows us to ship a 90-day supply, we can 100% do it. The only thing we would recommend, though, is if you're planning on using some of our pre-sorted disposable pill organizers, we would prefer to send you 1 month batches at a time. And so it'll automatically show up a few days before you finish the organizer. You'll get your next one. The thing is that in the event, let's say 2 weeks into it, if all of a sudden you add a new pill or remove a pill, all of a sudden all the disposable pill organizers need to be broken down and reorganized, which would be very challenging for everyone involved. And the insurance companies will not let us reship a new batch at that point. So, but we can discuss those options with you, you know, when you call.
Right, but if I have 5 or 6 prescriptions, do I have 5 or 6 pill organizers?
No. We would basically take all of those pills and stick it into one pill organizer. So each component would have all your medication there. So as opposed to sending you 5 or 6 different bottles and then you having to organize it, we do it all for you.
I keep it in the bottle. That's my organization,
Okay. You can continue to keep it in the bottle then.
the container.
But I would, Ken, you know what I'd recommend? I would check out, we'll send you the bottles, but ask for them to send you like an empty pill organizer. That way you can just see what it's about. Or we can stick jelly beans in there for you so you can see what it's like to actually open up a package. I hope you like jelly beans. Actually, we have jelly beans or Skittles if you call and ask for it.
I am totally blind, but
Okay.
my wife, who is sighted, helps out.
Okay.
Are your containers also color coordinated?
They can be, yes.
And a container that holds 30 days or 90 days, are there different varieties of those different quantity containers
Yes.
as a way to tell?
Absolutely. In fact, we have one pill organizer in particular that's specifically designed for caregivers. And it's one that we use a lot with a lot of assisted living facilities, where we add additional information to it for the healthcare provider to really reduce the likelihood of error. So it really explains step by step what the person needs to take. It has all the medical information. We actually put a picture of the patient on the disposable pill organizer as another layer of protection to reduce errors. So so Ken, there's a lot of ways we can approach it. If your wife's interested, we can send her a bunch of all of the samples and she could just
One last
Find out,
question.
so you can come back and say, hey, this is the one that's the good fit for us and, me and Ken.
Sure. One last question, which is, I'm
Sure.
assuming that you have a website and all of this is described on the website as well?
Yes.
And the website URL is?
If you go to accessiblepharmacy.com,
Okay.
it'll all be laid out right there for you, Ken. And thank you. Ken, those were all excellent questions. We'd like to move on to the next question, which was about glucose, talking glucometers.
Yes. So we actually just did, which is how we met Bill.
Right.
We ran a webinar with Be My Eyes, and we had a guest on, which was Prodigy Diabetes Care. Prodigy makes talking glucometers, and there's a few things that we're able to do with the Prodigy model in particular, which is it requires a little bit of programming. It's not too complicated, but it's almost like a clock radio programming. We'll pre-program it in advance for you based upon your needs. When you get the glucometer, if you need some assistance learning it or walking through it to understand how it completely functions, it's another way you can use Be My Eyes. So you can contact us through Be My Eyes, and we can walk through it and train you how to use it right there on your telephone.
Next question.
Jim, you have your hand raised if you want to go ahead and unmute yourself.
Sure, thanks.
Hey, Jim.
Hey, Jim.
Hi, how you doing?
All right.
So I am actually a consumer and I'm also a rehab teacher at MCB. So I'm asking this sort of from two different perspectives. But so one question I just wanted to clarify. One was, I think you were saying that you charge the insurance company, but not the person. So how does the free trial, what does it refer to, or how does it work?
It's fine. It's fine. We pay for it. Just in full disclosure, so we don't charge for freight. We don't charge for packaging. We don't charge for this 3-month supply of vitamins. We charge the insurance companies for medication. If there's a vitamin or an over-the-counter remedy that's not covered by insurance, we charge your credit card. We have both generic and brand name medication. If there's a small device that may require reimbursement, we'll actually fill out the form and submit it to the insurance company for you. Okay. We can't guarantee that they'll reimburse it, but it's a pain in the neck to fill out those forms. So we try to help when we can.
Yeah. So great. So my second question is, how do you deal with things like either something where, say somebody's on a medication where the doctor adjusts it in the middle, like they're on blood pressure medication, all of a sudden they need more or less, or, there's some kind of adjustment, or a medication where it's like, there are some medications like anti-anxiety medications where you have to they make you resubmit every couple of months for your prescriber to reauthorize it if it's like a controlled thing. How do you deal with those kinds of things?
That's an awesome question. We actually provide we call it active refill management, which is if any of your prescriptions are expiring or require a lot of controlled substances, require like Adderall, for example. It requires, it to be updated monthly from the prescriber. We actually perform that task on behalf of our patients. We'll reach out to your doctors to find out if any updates need to be implemented. We'll circle back around and communicate with you. If need be, we'll set up a conference call with both you and your physician and the insurance company if needed. There's a healthcare provider, whether it's a therapist or a nurse or even a caregiver involved, we can include that person in the conversation as well.
Okay, that's great. And so when there's how about like when there's like an adjustment, like you're on 12.5 milligrams of something and then they say in the middle of the month, right, we think you actually need 25, or vice versa.
Well, it depends. Hopefully that physician will notify us. If not, I imagine they notify you. If you need support at that point, call us and just say, my physician just told me this is the adjustment I need to take. Can you just help me the first few times while I go through it, just to make sure that I'm doing it properly?
Okay. I was thinking more of the timing, like sometimes it might be they change it and they say, so do you want us to send it to CVS, like for today because you need it? Do you know what I'm saying? Because it's a distance thing.
Yeah, no. I mean, how about this? If you need something tomorrow, we would have it in your hands tomorrow. The only time I would recommend for lack of a better term, not using us. And I mean this, I own a pharmacy. I just used CVS myself recently. Why? First thing in the morning, I woke up, I had a sinus infection. I contacted my doctor. We had a telehealth call, and she was like, all right, I'm going to prescribe for you an antibiotic. I know that my pharmacy could get the antibiotic. I live in the city in Philadelphia. Our pharmacy's in the suburbs. I knew that I could get the remedy first thing in the morning the next day, but I was hoping to get a dose or two in my belly before then. So I went to the CVS and paid for my antibiotic from CVS.
Okay.
Plus you got
Great.
cereal for the kids, which was good
Yeah.
too. So a little raisin bran.
Great.
Yeah, but that being
Thank
said, that being said, we could also facilitate that as well. So if you need something, we'll reach out to a local pharmacy and get this information in your hand. We can, obviously, not all pharmacies do the packaging and labeling that we do, but we'll try to support you as best we can. In addition, someone asked a question last night on a call. Let's assume you're traveling. Let's make pretend the pandemic doesn't exist for a second. And you're traveling and you're in Hawaii and you're like, I forgot my medication. Call us. We'll overnight the stuff to your hotel so you'll have it the next day.
Great. Okay. Thank you.
You're welcome. And we are licensed in Hawaii, by the way. So
Hey,
next time you go to Hawaii, just call us. We'll hook you up.
call.
Yeah, exactly.
Now you really got me thinking.
I'll actually do a site visit just to make sure, everything's okay there for the
Yeah,
delivery.
I'll carry the bags.
Yeah, exactly.
Next question. There's another good question.
How do you get the insurance company to pay for the difference of medication?
Good question.
Good question. We can't make them do anything, but we will, advocate on your behalf to make sure that, you're getting the best support that you need. We also, for patients, we provide open enrollment consulting. So if you are a patient and we're familiar with your medication, we actually have a software program. We can put your medication into the program, and it objectively gives us feedback about the different types of Medicare, Medicaid that you could use that could ultimately save you dollars. So Emily and Robin, I hope that answered your question.
No, I was asking about, say I was on vacation in Hawaii and I
Okay.
forgot my medication and you reordered my medication. Most insurance companies won't pay because the month is up.
Good
So-
question. It depends. It depends if you need let's say you're there for a long weekend. Okay. Usually the insurance company will allow us to provide you a temporary emergency, long weekend supply. If you say, hey, I'm going to be in Hawaii for the next month and a half, I don't know how much we can help you there, but we'll try. We'll advocate on your behalf.
That's what we do. Next question.
So initially to sign up, you just make the phone call and we talk with you and we figure it out.
Yeah, because it's like, our model is not a one size fits all for all patients. We need to have that conversation just to get an understanding about your level of vision, your level of dexterity, your insurance, and try to understand what are your current challenges with medication, and maybe we can troubleshoot together.
That's why it takes 10 minutes. We like to get to know you, find out what your needs are, what you hope to do. Next question.
Okay, say you go visit your doctor and while you're in his office, he gives you a new prescription. Does
Mhm.
he call you or are we responsible to call you and say, wait a minute, he just added me a new prescription?
Good question. There's a few ways that this will come about. There's a bunch of options. One is the doctor can call us. Two, on our website, we have a fax number, and then, some doctors still like to fax prescriptions over. Number three, we are set up in the electronic health system. Our fulfillment center is actually legally called Reliant Care Solutions. And so all you have to say to the doctor will ask you to say, should I send your prescription, your updated prescription, your new medication to Reliant Care Solutions? All you have to do is say yes, and it comes to us and it gets shipped out to you as accessible pharmacy. And that being said, if you have any challenges throughout any of that process, once again, just pick up the phone and call, and we'll do everything for you.
Next question.
I have a question
Go ahead.
Hey, Jerry.
about Hi, I have a question about the glucometer, whatever you call it.
Sure.
Talking
Do you-
glucose monitor.
do you
Product.
Yeah, it's
have-
interesting. We just learned, and they're the same word. A talking glucose monitor is the same thing as a talking glucometer.
Okay, do you have one that you don't need to do finger sticks with?
It's interesting. We're most likely going to be doing an educational webinar with Be My Eyes around a product called Dexcom. Dexcom is a continuous glucose monitoring system. I want to put a huge disclaimer out here, which is I am not a healthcare professional. So, but I'll paraphrase the stuff that I've heard. Ultimately, that's the future of glucose monitoring, but there are a great deal of issues related to them. They're still a little imperfect. So if you have questions about specific devices, call our pharmacy and someone will hop on the phone and have a conversation with you. But we'll also share with Jerry and Rachel some of these upcoming webinars that we have about some of these alternative solutions, and we'd love for you to join us.
So the good news is we're heading towards a measurement system for people who want to have the new upgrade for the next generation at Dexcom.
That would be awesome. Awesome.
Welcoming everyone. So,
Yeah.
Yes, and just some of the imperfections that I've heard and challenges that I've heard are, one, it actually requires an adhesive device, an adhesive sticker to hold it. It basically sits upon your hip.
Yep.
Apparently, sometimes the adhesive doesn't attach to everyone's body the same way. Two, depending on your type of diabetes, your level of diabetes, and your glucose issues, it can still be a little imperfect. But once again, that is my lay explanation,
Right.
just simply spitting back out to you what I've overheard some of our healthcare team talking about.
What time are you open to?
9 to 5 Eastern Standard Time every day. We're in Philadelphia. Just
And there's
outside
usually, we do have a crew in there until 9 doing up, picking and packing for the next day. So in an emergency, and then we also have an after hours phone number. So in an emergency, you can call and someone will get back to you shortly.
I'll correct that. We're open from 9 a.m. to 9 p.m. Next question.
Yeah, I have a question. If you're on insulin, I use the Trulicity and Lent. Will you guys be able to ship it out?
Yes.
Yes.
Yes, with the little asterisk, which is, I'm pretty sure we can. Like, I'm not familiar with all the brand names, but we carry everything. So, yes, I'd say 99.9% yes. I just want to give myself a little disclaimer in case I'm speaking out of line, but I don't envision it being an issue.
Yeah,
because that needs to be refrigerated.
Yeah.
Oh, yes, we
refrigerate everything on the way out of Reliant Care Solutions to you by mail, by
Yes.
UPS. It comes right to you refrigerated. So, good question. Next
Very
question.
good. Thank you.
Thank you.
You're welcome.
Next question.
Go ahead, Aja. I think you have your hand raised.
Yeah. My question is, so for people who, this is just like a general question dealing with other patients who may not necessarily need this service, but I heard one of the speakers mention the labels that could go on the bottom of bottles. Now, do all pharmacies do that? Like at a CVS, could you ask them to put the label at the bottom of the pill bottle for?
It's interesting. CVS, some CVSs, carry similar devices. They actually have their own device that they're playing with. Unfortunately, we haven't seen it anywhere.
Right.
They advertise it, no disrespect to them. I think a lot of it is they like to say that, hey, we're all about inclusion and diversity, but it's a behemoth company. So what happens at the corporate headquarters when they say, hey, we're going to try to figure out ways to support blind patients in particular, it takes a long time for that to trickle down actually to the pharmacy counter at your local store.
Right.
So to answer your question specifically, some pharmacies do carry it, not all do. You'd have to ask.
Right. And so the sticker that's at the bottom of the bottle that you place on the device, that sticker would
So
only be.
That's an RFID label, and yes, we have that 724 and the talking RFID monitor. So that's available to you on for free.
Right.
Okay. So yeah, when you're talking about the label on the bottom, what you're really talking about is an RFID sticker, so I understand.
Yeah, because I
Thank
just
you.
wasn't
That's
sure
very
if it
clear.
was something. Yeah, I just wasn't sure if it was like something that you guys did.
No, we do. We handle that through Script Talk, and
Mhm.
it's available as one of the options to all consumers nationwide.
Got it. Great. Thank you.
All right,
Oh, you're
next,
welcome.
we're rolling along here. We're getting everybody. Next. This is wonderful. I love these questions.
We don't have any more hands raised, but if somebody does have a question and wants to take themselves off mute, feel free to do that.
And also, just so everyone knows, like, we're not perfect, but here's what we can guarantee is that we're going to try. We're going to try our hardest. Everyone's very sensitive and aware of the needs of the blind community when you call. In the event, after trying us for a few months, you're like, you know what? I prefer my CVS.
Right.
We'll actually, similarly, we'll reach out to all your doctors, give them a heads up. We'll let the insurance company know. We'll contact your local CVS and say, listen, since you last worked with patient X, there's been some changes. We want to transfer the files back to you and just give you an update. And we'll do all that for free as well.
Can I ask a question about, this is called the Accessibility Pharmacy, but you mentioned a Reliant Healthcare team. What's the difference?
Oh, good question. So Reliant Care Solutions.
Oh, okay.
That is our distribution company. It's on our website, on our contact us page. So legally, in the world of medication cyberspace and the FDA, we are Reliant Care Solutions. It's the same company, it's the same pharmacist, the same call center, the same building. We're just legally set up with the FDA under Reliant Care Solutions. So it's invisible to everyone else. It has no value to anyone else other than when the doctor's entering the prescription. That's how we appear in that database.
So when you're talking to accessiblepharmacy.com or you call us on the phone, you're really talking to the company.
Okay. All right. Thank you.
Good question.
Thanks, Linda.
Thanks, Linda.
Richard, you have your hand raised.
Oh, someone else.
Yes, first of all, that was a fantastic presentation.
Thank you.
Thank you.
But again, with what I'm a little confused about is if you're changing pharmacies and let's say you, usually, my doctor loves the fax. And so the question is, if I were to change, would the faxes a phone number given, would that go to Reliant?
No, good question. It all comes to us. The fax number, it's basically, it's for all intents and purposes, no one needs to know about Reliant Care Solution, only the doctor. But the best way to do it, to switch it, is literally just call us. We'll do it all for you.
Okay.
We make it easy.
Very good.
Richard?
Thank you very much.
Oh, you're welcome. Thank you.
Someone else?
Well, this is Ken again. I have a question regarding that last comment. My pharmacy is on a hospital system patient site.
Yes.
So you don't have access into that, and versus calling my 5 or 6 doctors. So don't we as the consumer have to make that one central change to our hospital system to point to the right pharmacy?
We'll like I said, call us. We'll do it with you or do it for you.
Well, I mean, my wife can sit right next to me and we can do it.
Okay. Sure. But we can also, give her some like input and suggestions so that the transition's smooth. And if she has any questions, she can call us as well.
That's what we're here for you.
Okay. And as far as delivery is concerned, we all live in the wonderful world of cyberspace and Amazon deliveries and so forth. And they can't use the outside mailbox, I'm assuming. And sometimes packages aren't on the front steps. They're in the garden or someplace else.
Yeah.
It's-
In terms of your packaging, is it weatherproofed, and
so
ready
it's,
for
it's
stuff
interesting.
like
This
that
is
to happen?
yeah, this is that's a very real challenge, and it's something that we're very aware of and that we work on. Once it leaves our building, there are
Right.
things that we can do to increase the likelihood of success. So, for example, if we ship it, let's say for argument's sake, UPS, we can call you and let you know when the package is being delivered. We can set you up and we can help you with it. Set you up to get a text notification from UPS, an email notification from UPS. We can help you download the app so you're getting app notification from UPS. At the end of the day, we're aware of that challenge. We have been working closely with UPS. They're allowing us to add additional information on the outside of the package to notify the driver about certain, subtle nuances to the delivery. The challenge we have there is that we can do it in best of intentions, but the drivers are not required to read into the additional fields. But it's something we're aware of. And in the event that you're really concerned about something like that, we can actually track the package offline for you and call you and let you know the package should be there in the next hour. Like, get ready, it's coming. One other thing we're working on, it's interesting, is another level. We're trying to think of like different levels and ways to solve this. We can put Braille labels on the outside of boxes if that's relevant. And we're working with one of the NIB groups in central Pennsylvania. That's part of the Pennsylvania Association for the Blind. They actually make fragrances, and they're developing a concentrated fragrance for us so that we can actually basically spray the packages before they get shipped out so that they smell like very strong citrus flavors. So the hope there is that if, our package is in a group of packages, it may help you identify our package easier. Or if it is hidden outside, and we get that's a complete pain in the butt. Hopefully you can smell your way to the package as well. So
Next question, anybody?
I was just gonna say I'm glad that I get to find out more about this because as a rehab teacher, trying to find someone like the script talk was difficult. And like you said, not all CVSs carry it, so
Right.
it's hard trying to track down the device, and then people don't even know what it is.
Right,
So-
no, we're available for you. If you want to call us anytime and just talk about it, we'll also be having meetings in the future. We'll be scheduling that. So be on the lookout. March, April, May, June. We're going to have a host and variety of interesting subjects for you all.
yeah, Asia, I'm not sure if that was you speaking, but we also do provide training for therapists and healthcare providers if they want, and in some cases, depending on the degree, we're able to provide continuing education credits.
Yay.
To train, give you some insight about medication management, diabetes management, et cetera.
That's a good reminder for me because we gotta follow up with our OT team. So we should.
Okay.
Well, we're happy to serve you in that way.
Yeah.
I think Luigi's raising his hand.
I have a question. I'm on the 14-day Libra system. Do you guys carry that too?
Yes, I'm not as familiar with it as I am with Dexcom, but our pharmacy team is.
They do carry it.
Yes.
Yep. If you want to give them a call, they'll tell you what we have and it'll be there if it's in stock.
Yeah,
Yes.
because I deal with a company out of California right now.
Out of curiosity, do you like it?
Well, so far it's working good. I don't have to, perk my finger every, 4 or 5 times a day, 6 times a day. I just put it on my arm and, I just use my phone or they send me a little phone like that I can, gadget that I can just read my diabetes level.
Nice.
And so far I'm very happy with it, because
Is
it works
it
good.
accurate? Do you find it's accurate?
It seems like to be accurate, yeah.
Okay. Nice.
Because I check, I put it on the phone and on the other little thing that they send me.
Okay.
Both of them are equal.
Nice.
So I was wondering, if you guys carry that, I'm gonna give
yeah.
the pharmacy a call and see what, what it takes for me to get it from you guys,
Good.
What
Give us a
insurance
shout.
will
We're always
cover it.
happy- Give us that shout. We're always happy to work with you.
For more information, go to accessiblepharmacy.com, phone number 215-799-9900. contact Jerry Feliz, Access Technology Director for MABVEED. Email jfeliz@mabcommunity.org. Phone number 857-443-6636.